All right. I want to formally welcome everybody to what is sure to be an awesome night tonight. We are going to be talking about hormone optimization. We're going to be talking about pellet therapy, bioidentical hormones, what that means for males, what that means for females, and everything in between. I'm coming to you live from New York City tonight. My name is Greg, and I'm the BioTE area manager for NYC up here. We have an all-star lineup of speakers for you tonight, including Dr. Mary Laura Klesaris, who's coming to you live from Skintology in the other room here. Dr. Klesaris, can you say hi for us? And then we also, how's it going? And coming to you live from Austin, Texas, we have two awesome practitioners down there. We have Dr. Jennifer Walden, owner of Skintology NY, and of course, Dr. Jennifer Walden and her private plastic surgery practice and med spa down in Texas and Austin. Can you say hi for us?
Hi guys, thanks for coming.
And we also, of course, last but not least at all, we have Karen Zizzo, nurse practitioner and bioidentical hormone specialist at Dr. Walden's Med Spa down in Austin. Some of you may be familiar with her. Can you say hi for us, Karen, again?
Hi, everybody.
Fantastic. So like I said, this is an all-star lineup of speakers tonight that we have curated for you. We're going to take about an hour of your time talking about hormone optimization, talking about pellet therapy. I really need you guys to stay on to the end because we have a special surprise we're going to be unveiling. It's going to be financially worth your while. So I fully encourage you to stay on to the end. And we're going to be recording this session and sending it out afterwards. So if anybody wants to share with family and friends, that's going to be available for you as well. A couple housekeeping items before we kick off. We are going to make this as interactive as possible. We want you guys to ask questions. So the question and answer function is going to be at the bottom of your Zoom panel. I want you to utilize that as much as possible. We'll actually be answering those questions live as they come in. So make sure you identify that question and answer section on the Zoom panel and save anything that you want to ask us and just begin, asking your questions as we go through this presentation. So without further ado, let's kick this off here. And the theme tonight is going to be something small can make a big difference when we're talking about pellet therapy. So of course, I told you we're coming to you live from NYC and Austin, Texas tonight, and we're going to say, what are hormones and why are they important? What is hormonal imbalance and what do you need to know? So a general rule of speaking is hormones are chemical messengers made by the endocrine glands, and they work in a lock and key fashion. So a lot of us may be feeling like this these days. We have COVID-19 going on. It's wintertime, so up in New York, it's a little cold. It's maybe not ideal. And I don't know if any of these symptoms sound familiar to anybody. The brain fog, the hot flashes, the night sweats, the weight gain that's resistant to diet and exercise, maybe the decreased libido, decreased sexual performance. If that speaks to you, we want you here with us tonight. We want you paying attention because we actually have a solution that's going to work for you. So the BioTE method, when we're talking about bioidentical hormones in the BioTE method, we're talking about optimizing testosterone. We're talking about optimizing estrogen. We're talking about optimizing thyroid. And we're also talking about some medical grade supplements that you can take on top of your pellet therapy that you receive in the office to really optimize your health outcomes. Without further ado, I'm going to pass it off to the first speaker tonight, the medical director of Skintology NY, an integrative practitioner. She's great. Dr. Mary Laura Klesaris. Dr. Klesaris, I'll hand it over to you.
Good evening, and thank you all for joining us. We're going to start off this first slide with andropause. And what is andropause? Well, I like to say that I would like to say that men have hormones too. These tend to go down at a little bit slower rate than we see in menopause for women. In the andropause, we just take the word apart, meaning andros, male, human, male, and that's in Greek. And then we look at cessation. So andropause being cessation of the major male hormone, which is testosterone. We do see 20% of males have 50% low testosterone. As far as what it's linked to and how they may present, we may see them presenting with fatigue, like Greg said. We may see them presenting with actually depression. So it's really important that we look for these things early and we link it to hormones and we check their hormones as soon as possible. You do see this also in high blood pressure patients, diabetics, sleep apnea, chronic conditions, often very underdiagnosed. Their first visit may be, like I said, with a psychiatrist, and it may be depression, when in essence, it's just low testosterone. So next slide. Testosterone again, let's talk a little bit more about the facts. So what can it protect? Extremely protective when started early and done right. We only use bioidentical hormone replacement therapy as opposed to synthetic. That's important to remember. And we only use evidence-based medicine. So the major symptoms relief we would see would be for bones, brains, breast, heart, and relationships, as we like to say. So testosterone can help all of those. Large amounts in men, of course, more than women. And we see women aged 20 to 40 can lose up to 50% of their normal testosterone per year. So that's huge. Next slide. This study, just an overview of a very big slide, it was done in young men. And what we see was that even though the number that you see that would be considered normal testosterone may actually not be enough. We want people to have a normal testosterone level, but we want to go beyond that and have them be optimal. So when we look at the lab slip and it says 200, 300, that's okay. We aim for 900 to 1100 because we know based on research that patients not only feel better, but they have this protective effect. So if you look at the slide at the bottom, depression, erectile dysfunction at very low numbers, but even when they say it's a normal level, 600 or 700, you can still see things like Alzheimer's disease, prostate cancer, diabetes, fatigue, loss of libido. So these are really important to remember. Next slide. So the positive effects of natural testosterone for men and women, we can't state this enough, and I will be saying it over and over because it's so protective. So testosterone in men and women will protect breast tissue, prostate, brain, heart, and bones, including we're going to enhance the sarcopenia, which is like loss of muscle in men especially. So we look at increased muscle strength, bone strength, reduced body fat, and again, like I said, decrease in depression and anxiety. One of the major complaints that I get in my office would be for brain fog, or I just can't remember where I put this. That definitely can be improved with optimization of the hormones, specifically with testosterone. Next slide. So in this slide, we just see that heart disease in premenopausal women, the rate of death for heart disease is 1 in 7. And then we jump over to postmenopausal women, and we see that that number goes to 1 in 3. So 33% of women, we're looking at heart disease and death from heart disease postmenopausally. That's why it's so important that we optimize hormones early, and the earlier we start, the more cardiovascular protection that we see. Over 6,000 women in the US enter menopause daily. That's quite a bit. And you may have a perimenopause period. And I want to just talk about that a moment, because the perimenopause period is where we want to capture you. The reason we want to is because you're having those early symptoms. There's no reason that you need to suffer. You should be getting on board, getting your hormones tested, and see if you need to optimize your hormones in that early perimenopause time. Next slide. So facts about estrogen, again, over 400 functions in the body. The main thing I see in women, we want to control the hot flashes. We want to maintain bone density. We will be checking a pre-treatment DEXA scan just to check and see what your bone density is, because we do see dramatic improvement in a very short period of time, specifically in the bone density. We can rebuild that bone with the estrogen and testosterone. Also maintains collagen in your skin for a youthful appearance, and also the serotonin and dopamine hormone. So like I said before, anxiety, depression, insomnia, those things can all be affected. Next slide. Positive effects of natural estrogen. Again, the reason we're saying natural is because we like bioidentical estradiol, okay? Again, controlling hot flashes. And then we're gonna add to that lowering cholesterol and increasing HDL. HDL, of course, is the good cholesterol. This protects us against heart disease, and we're happy to have that added benefit from the estradiol. Also maintaining bone density, increasing bone strength, and then prevention of neurodegenerative diseases. When I say that specifically, I think of Alzheimer's disease, even Parkinson's disease. So we do get some natural prevention of these conditions. Next slide. I'll pass it off to Karen.
Good evening, everybody. I want to talk to you a little bit about the options that we have for hormone therapy. And the great thing is we have several. Going back a little bit as far as synthetic hormones, we have the familiar Premarin, otherwise known as pregnant mare's urine, the medroxyprogesterone. Those were all synthetics, and those were all the ones that were studied with the Women's Health Initiative study. Currently now, we have many other options for bioidenticals that come in forms of pills, patches, creams, gels, or pellets. Next slide, please. So I wanted to kind of just go over a little bit of the differences and some of the good and the bad and the ugly with all of the variety that we have. With creams and gels, okay, a lot of times if you're doing bioidentical creams, you're going to have a biased cream. You'll also have a testosterone cream. So you have a lot of cream that you're rubbing in sometimes 1 to 2 times a day. That can be a pain, especially in hot, humid climates. It usually comes with a shorter half-life. It can transfer to your partner, to children. And the important thing to take note of is with estriol, it does not protect in the bones, brain, and heart. And that is proven in various studies. With injectable testosterone, and that is considered to be what a lot of men come in and ask about, because they have heard about that in the gyms and from their friends. But it turns out that it can have a definite roller coaster effect, meaning you give the injection, say on a Monday, and by Thursday you are already kind of crashing. They're wondering, you know, the weekend's coming up. I wish I felt as good as I felt on Wednesday. It's 99% synthetic. It's testosterone cypionate. It can be unevenly absorbed, and it comes with some adverse events. It can cause some liver toxicity. It can enhance heart disease. It can elevate the bad cholesterol and decrease the good cholesterol. And it seems to always wear off before it's time. And it can, and I have heard men come in as well as their women that come in and say, my man is angry and irritable and he needs to go find a smile. So it can cause some irritability as well. Next slide, please. So then it gives us a really good choice that we are now able to use with pellets. And the bioidentical hormone pellets, they're natural, they're derived from plants. It's bioidentical in the way that it has the same molecular structure as the human hormones. And it also lasts much longer. It lasts up to 4 to 6 months. It's a simple insertion. As you can see in the person's hand there, it's basically the largest one is a kind of a size of a grain of rice. It's the most widely studied form of bioidentical hormone replacement therapy, and it provides a very steady state level in your blood, which really, really improves your side effect profile and really helps with treating hot flashes, sleep, energy levels, libido, all of the good things. It also comes with an individualized dosing or an algorithm where we enter specific to you and only you based on do you have history of breakthrough bleeding? Do you have a history of acne? Do you have hair loss? And so you have a very individualized dose that's specific to you. It's implanted under the skin. It's done in the office. I perform several every day, and it takes literally 5 minutes, 5 to 10 minutes. The most painful part, people tell me, is just the little pinprick of the needle to numb the area where the pellet is going. And you don't know it's there. Next slide, please. I think this is a good illustration of what I was kind of referring to as far as the steady state levels. Now, the patch is a great method as well. However, you have to apply it a couple times a week. It comes with adhesives and residual adhesives on the skin. And as you can see with the orange, that is the patch. It's a definite improvement in the oral that is illustrated in the purple, where you have up and down peak and trough levels every single day because of the shorter half-life. But if you look at the green and the consistent steady state, that would be more of the pellet, and that is going to have continuous side effect control. And if you go on a trip and you forget your patches or your pills, you're going to definitely be able to sleep on your 2-week vacation versus if you left all of your hormones at home. Next slide, please. So what is the BioTE method? It is based on the right kind of hormones, which are the bioidentical, closest to your endogenous hormones. It's the right amount. And going back to what I was talking about with the algorithm, it's a lot of time in the dosing to make it absolutely perfect for you specifically based on all of your different variables. And it's the right delivery system by injecting the pellet. And it really helps the body return to the normal hormonal balance and increase optimal functioning. Next slide. So everybody wants to know about, is it safe? As I get that question every single day on a number of things, but it is, there's hundreds of studies on pellets. I was surprised to hear that there's 75 years of experience and it's used in 5 continents. It is clinically effective. There, again, are even levels, and there's not the roller coaster effect with pellets. Because of the pellet is inserted in the office, and you have, you don't have to worry about your testosterone or your estradiol for another 4 to 6 months. And obviously it's convenient, and people are definitely improved with compliance because you simply aren't going to forget it. It comes with a low side effect profile. I have noticed, especially with men that have had testosterone injections in the past and they switch over to the pellet, you don't have the side effect of polycythemia nearly as often, or higher estrogen levels. So that is a wonderful thing, because a lot of men on testosterone injections have to go do therapeutic donations, and they don't like that very much. It is the best method to increase bone density. There is no evidence of increased breast cancer risk, and it does not stimulate the breast tissue. It's not been shown to have increase with blood clots, heart attack, or stroke. And it does show that hormone optimization may be protective to the breast, bones, brain, heart, and relationships. Next slide. Turn it back over to Dr. Klesaris.
Thank you. So I'm just going to continue and talk about breast health and bioidentical hormone replacement therapy with the BioTE method. There are literally hundreds of studies that we've read and that we can share with you, basically saying how safe BioTE is. So the testosterone delivery by pellets does not, like Karen said, increase risk of breast cancer. This is unlike any other type of testosterone that you could take, whether if you're taking it orally or if you're taking injection. There's always some other risks involved. We don't see that with the BioTE method. The testosterone implants show less stimulation of breast tissue. So this is our preferred route of testosterone. Estrogen alone does not increase the risk of breast cancer. I just want to talk a little bit about the study. They did have a huge study on estradiol. This was done in 2001, called the Women's Health Initiative. And the estradiol alone did not increase the risk of breast cancer. The reason I'm saying alone is because there was some synthetic Premarin that was given at the same time that did increase risk. We would not do that to you. We do not give that. We only giving the estradiol and the testosterone. So completely safe. Treatment with testosterone and estradiol alone does not increase breast cancer. We cannot say that enough, even in breast cancer survivors. Next slide. And here's one of the studies that I was talking about, 2,755 women, Journal of the National Cancer Institute study. And this was saying that breast cancer mortality was lower, 16 per 1,000 persons per year in the hormone replacement therapy uses versus 30. So that's double. That's a great improvement. So also breast cancer recurrence in 17 per 1,000 per year in women who used hormone versus 30 per 1,000 for the non-users. And next slide. Bone, brain, and heart health. Again, we're going to drive this lesson home for you, because it's really important to know that testosterone, again, is a bone builder. Testosterone is a bone builder, and actually many studies, again, proving this. This is a study from STUD at all the relationship between plasma estradiol and the increase in bone mineral density in postmenopausal women. This is after the implants of the testosterone implants. So what we see is, and this is huge, a 4-fold increase in bone density over oral estrogens and 2.5 times greater than patches. So what we see is a bone mineral density increase of 8.3% per year for people who were pelleted with testosterone. Next slide. And arthritis, this is really worth talking about, since it's the 4th leading cause of disability in 2020, osteoarthritis specifically, which we consider the wear and tear arthritis. We definitely see improvement in joint pains with the testosterone pellets. 10% of men and 18% of women greater than 60 have osteoarthritis. I do want to also say that both the estrogen and the testosterone can stimulate precartilage cells, and in cases reversing the development of arthritic changes. I also see progesterone helping in this case. Some of my patients just present with joint pains. That is basically saying that their hormones are not optimized. Once their hormones are optimized, I see a relief in their joint pain. Next slide. Alzheimer's disease, again, worth mentioning. Women get Alzheimer's 8-to-1 over men. Women on estrogen are 50% less likely to develop the Alzheimer's disease, and men with low testosterone are 3 times more likely to develop Alzheimer's disease. This is not only Alzheimer's, but also all neurodegenerative diseases that can happen. So for instance, Parkinson's disease, we do see this is an anti-inflammation effect that we get from testosterone, and numerous studies showing this benefit. Next slide. Women, hormones, and the heart. Again, so we are going to talk about how this estrogen replacement with the pellets, what is the positive effect? Well, a lot of women come complaining of middle belly fat. Once we pellet them with the testosterone, and we also testosterone with the estradiol pellets, we do see a decrease in the body fat composition of women and men, more so in women because those are the ones complaining of it. We do see increase in HDL, which is the high density good cholesterol, decrease in triglycerides, and also overall decrease in the cholesterol panel. The marked reduction in fat mass was seen in the estrogen plus testosterone group after 2 years, and neither one negated the other. So many studies, again, showing the benefits of natural testosterone on the heart. Next study. Men hormones in the heart, again, decrease in total cholesterol and LDL, which is the bad cholesterol, increase in HDL, metabolic factors, marked reduction in fat, and improved lean body mass. When men come into the office, they ask us, how can I get rid of this fat? I can't tend to build muscle mass. So it's not only getting rid of fat. Men may work out and they're still coming to our office saying, I can't seem to build that muscle that I used to be able to build. And the testosterone is what seems to get them there. So many studies, again, showing the beneficial effects of testosterone on the heart, but also increasing lean body mass. Next. Key facts about pellets, just going to regroup here and say, again, not all therapies are equal. And when we say that, what I'm talking about is synthetic versus bioidentical. Bioidentical, natural to your own body. It's similar. It's like a mirror image of your own, made out of soy or yams, versus synthetic, made out of urine, horsemare, horsemare urine. And then also balancing the testosterone and estradiol. This is not a one size fits all. What we mean by that is that we will specifically have a plan individually for each person that walks into our office. We want to balance their testosterone and estradiol, and also their micronutrients that turns on their hormones. We want that as an individual plan for each person that walks in our office. So the important thing is start early. You're going to get a steady state dose. You're going to feel better, have an improved sex life as well. And that's all with the BioTE form. So please call us at Dr. Jennifer Walden Skintology, and we're here in New York City. Thanks. Next slide.
Hello again. I'm glad Dr. Klesaris hit on the very last part about the supplements, because that's one of my favorite things. And as a functional medicine provider, I love that part almost as much as getting someone better with hormones. I consider it kind of like icing on the cake. And there are several hormones and supplements that really kind of go hand in hand. The first one that I want to refer to is DIM. DIM is, to me, if you put a lot of cabbage, broccoli, cruciferous vegetables in a blender and blended it down, that's kind of how natural it is. It is wonderful for men and women, because men and women have estrogen, and women that and men and women both metabolize estrogen, and this kind of helps direct it down the right pathway in the most safe way to metabolize estrogen. And it improves the results and makes the pellets last a little bit longer. Next slide, please. ADK, vitamin A, vitamin D, vitamin K, 10,000 IUs. We also have it in 5,000 IUs, depending on what the vitamin D level is. This is a great one because it does come with the potassium. Oftentimes, patients do not absorb. They've been taking vitamin D at home. They come in, their levels aren't really moving, and a lot of times it's just needing the addition of potassium in order for optimal absorption. It also improves bone health when it's combined with potassium. I call vitamin D the mood booster. Most of my patients that come in more of a melancholy mood, once you optimize their vitamin D level, the 60 to 90 range, they can tell a definite boost in their energy and their mood. It helps with heart health, bone health, metabolic health. It's a great one. And I put pretty much every single patient of mine, depending on whether it's 5,000 IUs or 10,000 IUs. Next slide, please. This is my favorite one, the methyl factors. This is because of all of our neurotransmitters, our building blocks are made from the B12 and folic acid. Over the years, I've learned more and more about different type of genetic defects, which we're not able to metabolize and absorb B vitamins and folic acid unless they're in methylated form with specific types of genetic defects. This is a great one because it offers 3 milligrams, which is quite a bit, of a 5th generation folic acid. It also offers several different forms of B, and it offers the methylcobalamin form of B12, which is wonderful to help boost energy. And it also helps maintain, along with the methylated folic acid, a healthy homocysteine level. Next slide, please. Gut health. Gut health is very important. It's our second brain, is our gut, and our microbiome seems to be damaged with our American diet, our high stress life, our quick pace. Getting your gut healthy is imperative for immune response. This probiotic that we utilize has got several strains of probiotic. It's vegetarian, dairy, and gluten-free, and it does come with 20 billion colony-forming units. It's very important to have billions of colony-forming units. Many probiotics are in the millions, and this one stands out because of the 4 strain and the amounts. It helps restore the microbiome. It's wonderful if you have someone with a lot of allergies, because a lot of times that goes along with improving your gut health. Definitely will affect and improve digestion. And it's a really good one, and you don't have to keep it in a refrigerator. Next slide, please. So lastly, what I wanted to talk about, what I also offer patients here in Austin at Dr. Walden's office, is there's many different other things to help with whether it's erectile dysfunction or vaginal rejuvenation. While BioTE is great, and oftentimes that's all that is needed, is to improve libido, energy, stamina, improve sexual response. Sometimes there's a little extra help that is needed. For example, the Big D wave, I use that with my male patients that have experienced erectile dysfunction. It's utilizing extracorporeal shockwave therapy, or otherwise sound wave therapy, to break down plaque in the penis. And it can improve the blood vessels and help generate new ones. And this obviously will help with vascularity and improve blood flow, which is very important with erectile dysfunction. It's also been known to improve Peyronie's disease and sensation to improve sexual performance. And this is a procedure that is done, we do it a couple times a week for maybe a series of 3 to 4 weeks. And it takes approximately 15 minutes, give or take, in the office. It is not painful. For the women, there's Votiva or Diva. Votiva is more of a radiofrequency treatment, non-invasive, non-painful. It helps improve the collagen and remodel the existing collagen, and helps produce new collagen to improve the vaginal mucosa. As we go longer into menopause, the vaginal mucosa will become thinner, more paper-like, sometimes with bleeding. This kind of helps improve the vaginal mucosa. Diva is a laser It is a little bit more vigorous, but it comes with wonderful results. It also helps with stress incontinence. And then lastly, for the men and women is the O shot or P shot that we offer here. And the Priapus shot is utilizing the plasma-rich protein. Blood is drawn here in the office. We spin it down. We take the plasma off. We spin that down again. During this time, the man is numbing, and then we inject it in a series of a few injections into the penis. This sounds much worse than it really is. I've had men come back and do this again because they were pleased with results, and with the numbing medication, it is not very painful, I've been told. The O shot is for the ladies. It is very, very similar, same process of collecting the PRP, but it is also injected into a numbed area near the clitoris and the upper vaginal wall. And this will, again, improve the rejuvenation of the cell and promote increased blood supply and improve the tissue. And this is more for women that have told me that it just feels kind of numb. And that reaching orgasm is extremely difficult and it takes longer and longer. And this is a very good treatment option. It is also very helpful, not just with the vaginal atrophy, but also with stress incontinence as well. And so this comes to the end of my segment. So I'm going to turn it back over. Thank you.
Okay, and I was just going to end here. Basically, I hope you've gotten some good information. We didn't want to keep it too long, so I think we're well under an hour. If you have any residual questions, we're happy to answer them in the Q&A box. We can answer your questions in generalities, but in order to, see and actually diagnose and treat, we'd need to see you in person or by our telemedicine and be able to order labs and do a physical exam. So neither intended to diagnose or treat. We wanted you to learn a little bit about BioTE pellets. Speaking personally, I gave birth to twins 10 years ago and moved to Austin, Texas. And that's when I was introduced to BioTE. And I've been doing them for about 8 years now. And it's really helped, with fatigue, with kind of body form as far as muscle mass and performance and getting rid of fat. It's just been a real game changer for me as I was getting older and I had high FSH levels, early menopausal signs. And so it's been really great for me. And so you can certainly find more information on our website. We can go to the next slide here, Greg. Our contact information is up on the top left is Skintology Med Spa. We're at 57th between Lexington and 3rd in New York. We're open. We are doing all social distancing protocols are in place and taking temps, screening and that sort of thing. Same thing in Austin, Texas. We're in Westlake. If you know Austin very well, that's out in kind of Southwest Austin. And that's where Karen Zizzo, our nurse practitioner, is. Our URLs are right there for our websites, and we have, your email from the registration list. So we'll send you kind of a copy of the link for this video, so you need it. But I wanted to give you guys a promo code, and you can use it on my shop site. So I have a shop site that has BioTE supplements on it, as well as a lot of different skincare brands. And this is a little bit of a secret because only you guys that join get this. We'll probably send it to the registrants a little later, maybe a week later. But you can use promo code BioTE21 at checkout for 21% off of all products till February 1st. And so the BioTE supplements are great, like Karen talked about it, even if you need new skincare or whatever. That's a pretty good buy. That's like our Black Friday special type deal. So 21% off at shop.drjenniferwalden.com using BioTE21 at checkout. So write that down. And let's see, it looks like—
You want me to some questions, Dr. Walden, and you can answer them live? Would that be a good way to close this off?
Sure. And let's see, we got at 5:37. This is Larry's wife. Are there any contraindications to using the pellet regimen with any medical conditions? And I'm going to let Karen, who does this part of my practice, answer that.
Well, I mean, obviously with any type of active cancer, that would not be a candidate for estradiol and testosterone therapy. Any type of perhaps immune deficiencies, or the other thing I was thinking of is any history of stroke, perhaps with the estradiol, but I would have to, refer to the BioTE literature to find out a little bit more specifics, as if I could be leaving anything out.
And one of the important things I think that we talked about is that it doesn't, in women, it doesn't heighten the risk of breast cancer. To use BioTE or testosterone is shown to be somewhat protective. And I think that's an important thing to know. There's a lot of different, all sorts of things you can learn online, but the testosterone has shown to be somewhat protective. So let's see, what if you are currently on synthetic pills? Do you have to go off them before doing labs? Dr. Klesaris, can you chime in and take the mic for that one?
Sure. So this is a case by case, depending what you're on, how much you're on. I would not want you to dramatically just immediately stop your hormones. I want to see where you're at, and then I can transition you over to the pellets.
Let's see here. Okay, so I'm gonna call on Cavi, our office manager in New York City. Can you talk about the cost associated with pellet therapy and BioTE supplements? Cavi, can you rattle that off for us? And then Kim will talk about it for Austin.
Hi everyone. I'm Cavi in New York, so I'll just talk a little bit about the pricing. Price really does vary per treatment. Really, for the BioTE pellet insertion here, we're offering our DIM supplement as our special with the insertion fee. So for female insertion, it is $600. For male insertion, it's $950. We can talk about scheduling, how often we would recommend that you come in with you whenever we do the consultation. As for pricing on packages, we do pricing on packages for the big D wave, O shot, and B shot as well. So, it really depends, but we can definitely customize a treatment plan for you that's going to look good and help you feel good.
And I'm going to turn this over to Karen, because in Texas, everything isn't always bigger in Texas. And actually, our prices are a little lower in Texas just because, as you know, New York has higher cost of living, higher prices. But Karen can go over our pellet prices in Texas if you are near us, more in the southern United States.
So pellet prices here is the female insert is $350 each pellet that is inserted. That's about every 4 to 5 months. And for males, it is $750. And that's primarily because they're getting significantly more hormone in the insert.
And can you go ahead and answer? And another anonymous attendee, what about progesterone therapy?
I love progesterone. We utilize that. I utilize that with women that have and do not have uterus. Obviously, you have to utilize progesterone with a woman with a uterus because you don't want to have unopposed estrogen to the endometrial lining. However, progesterone is very breast protective. I call it the Zen hormone. It's wonderful for anxiety. It helps women sleep. It's very breast protective. It helps with vaginal dryness. It helps with hot flashes. So we use progesterone consistently.
Yeah, I think progesterone is good. It helps you sleep really as you get older, which I need. So how do these items work with osteopenia? Can it reverse or help that? Any studies on that? Dr. Klesaris, can you chime in about osteopenia, please?
Sure. So for osteopenia is on the spectrum, you're leading towards osteoporosis. So that's the perfect candidate. And yes, we do see some reversal of the bone building. Again, testosterone is bone building. We can actually see a reversal, and we have seen that in many studies behind this, showing some reversal of what you see is that decline in bone density. So osteopenia in young women, especially in young women and leading into perimenopause, we can give the testosterone pellets and that we see a significant change. That's why we like to get like a DEXA scan or bone density beforehand, and we definitely see an improvement afterwards in a short time.
Talking about contraindications, I'll take the one for O shot or P shot, which is platelet-rich plasma. It's the most organic treatment you can get. So there's really not any major contraindication to O shot or P shot unless you were told not to get a venipuncture in a certain vein in your arm, because we have to take blood and centrifuge it down, and then we insert the platelets. We inject, whether it's the penis or into the vaginal vault or around the urethra. And so there's really no major contraindication of that, because it's your own body's blood cells, and it helps to lubricate and it helps to kind of form new collagen and lay down new collagen. And usually you have to get those in a series, but it is a very organic treatment. And so are there any contraindications to the pellets? Dr. Klesaris, what do you think? Not many.
Not many off the top of my head. Greg can expand on that.
Yes, great.
I think we've covered that. Active cancer is obviously going to be a contraindication for anything that we do. The best thing, if you have a question about that, is to come in for a consultation with the provider directly.
I got a thyroid expert here. So Karen is going to take this question. What about thyroid optimization?
Yes, thyroid optimization and doing this more from a longevity or anti-aging point of view. We're not necessarily going by what the lab considers the normal TSH. So absolutely, optimization is the perfect word for it, because we want to optimize your thyroid. We want to optimize your free T3 level. We want to optimize your free T4. We don't look just at a TSH. We kind of take the whole picture. Free T3, we only have about 6% of that, but that's kind of considered like the gold. So we definitely want to optimize that. We utilize and prescribe hormone therapy and thyroid often hand in hand. And again, that's another one of those things that goes into that algorithm that spits out the specific and perfect formula for the patient.
We'll just take these two logistic questions here. Other than general questions about your health history, is there any kind of testing done, right? Lab testing, and she can go over that. And is normally one pellet per treatment, or does it vary? And Karen can go over that, but it does vary case by case.
Okay, so the general questions about the health history, of course, we want to know your health history, your immediate family health history. But as far as testing, I think Dr. Klesaris mentioned the osteoporosis screen, but we routinely, of course, do labs, because you'll get your labs done. I do an initial hormone consult. At that time, you're going to be sent off with a lab requisition. We basically will look at a metabolic panel, a CBC, an estrogen level, FSH, vitamin D level, vitamin B12 level, magnesium level. Depending on your metabolic history, we may look at a hemoglobin A1C, but primarily we're going to look at thyroid and your basic hormones. And these are also things that we manage and monitor consistently throughout. We're going to put the pellet in after we get all of the initial lab work back. And then at about 8 to 10 weeks, when your pellet is at its glory, we're going to find out what your baseline is, because when you come back in about 4 months, 5 months later, then we're going to need to know how are you feeling? Because it's not just about the labs, but we will take a subjective and an objective report. And so, yes, we do lab testing along the way. Next question, is it normally one pellet per treatment, or does it vary? Of course, it's going to vary. I mean, I have a patient that only will get 100 milligrams of testosterone, and that's one pellet. So yes, but normally if it's a postmenopausal woman, they will do estradiol as well as testosterone, and the dose is going to be very individual with testosterone. You may have 100, you may have 125, you may have up to 175. With men, it's a whole lot more. They come in 200 milligram doses. Oftentimes with men, the range will be 1200 to 2400. So you may have 6 to 12 pellets. So that is going to definitely vary.
And there's inserted, kind of you can talk a little bit about the insertion in the glute, kind of subcutaneous, like underneath in the soft tissue of the buttock. And it's done under local anesthetic. It's absolutely painless. It takes about 20 minutes to get it done, but you can tell, kind of a little bit about the insertion.
The insertion is done with a trocar that, as Dr. Walden mentioned, I mean, I numb the area with a very small needle with some lidocaine. And that, you know, it's just the pinprick of the needle to numb the area that anyone even kind of flinches. It is painless. I get pellets. She gets pellets. I give her pellets. It doesn't, it really, it's not painful.
Yeah.
You need to, you know, take care of, you know, you don't want to be too active the following day. You're not going to go out and do a bunch of squats or, you know, run 12 miles. But as long as you kind of take it easy for a day or two after, there's virtually no pain.
Dr. Klesaris, this is a good question. I'm interested to hear the answer too. If you have an increase of 8.3% of bone density each year with testosterone pellets, could you or would you eventually restore 100% bone density, or do we not know the answer to that question?
It's possible is the answer. It's possible. Studies have shown that it's possible.
So that's pretty cool. So you've seen people.
I've seen people reverse, that they are no longer in the osteoporosis or osteopenia fold.
Yeah, that's amazing. I think for you know, older women especially, they're more prone to hip fractures and that sort of thing. That's a really big deal, I think. Follow up, not a young woman, an older woman. Well, this is not old, 62. Still any help with osteopenia? So at age 62, would it help? Can you start later?
Yes, the earlier the better. However, we still see improvement and some reversals of the osteoporosis.
Yeah, so it doesn't matter how old you are starting pellet therapy to help with all of these symptoms and findings. I've heard that BioTE hormones can have side effects like increased facial hair in women, breast tenderness, weight gain. Can you talk about it? So I've been getting BioTE for about 8 years, like I mentioned. And one of the things initially, you kind of in this period of time, you'll get hirsutism with it, which is you can get some hair growth on your face or under your chin that you didn't have before. And luckily enough, we're in a plastic surgeon's office here and in New York. So you can get on spironolactone, which is something I've taken, but that also helps amazingly with skin. And so when I started pellet therapy, I was so excited because my skin got a lot better and less breakouts and that sort of thing. So spironolactone is prescribed, which is it's like a mild mild diuretic type deal, but it helps at lower doses with facial hair growth and skin quality. And so that helped a lot. Voice changes can occur. Your voice can go a little lower. Spironolactone can battle that as well. Breast tenderness, weight gain, those are things that are more associated, I think, with the estradiol component, right? And progesterone.
Right.
Can you speak to that?
Initially, you can occasionally, and I wanted to also speak to what Dr. Walden was saying. I have as many people that have absolutely no facial hair or acne as some that do, but it's very mild because again, that all is going into the equation.
And you can do laser hair removal. That was the other thing. Yes.
Breast tenderness and weight gain. Okay, usually that can be either associated with two things. It could be either the estradiol dose, which is a very transient thing because once the pellet is inserted and it kind of kicks in, I would say that at about 8 to 10 days, you can have a little bit of breast tenderness or nipple tenderness. That is usually, like I said, it's pretty, you know, quick and goes away in a week or so. It can also be associated with progesterone as well, with a new start with progesterone, because progesterone excess as well as progesterone lack of kind of mimics each other in the same that it can cause those symptoms. Weight gain is oftentimes just more of a water retention with an increase with the initial first time using the testosterone, and also estradiol can do that, but that is very insidious and it goes away.
Can you do this when you do some hair loss therapy with PRP? She does do, Karen does do some hair loss therapy, and so she can speak a little bit. I mean, it's a book chapter probably that would take a long time, but briefly, you can tell hit the main points of how to approach hair loss.
Well, hair loss, I'm going to look at several different things. Again, I'm going to go back to all of the vitamin deficiencies because I think is your magnesium optimized? Is your vitamin D optimized? What is your testosterone level? What is your thyroid level? It could be a little, too much, too late.
You look at that too.
DHEA, I always look at DHEA. If someone has a higher DHEA and also kind of a higher endogenous testosterone level, there may be some polycystic ovarian syndrome and oftentimes that can be associated with some hair loss. So I look at a number of things with hair loss. And as far as what to do if you start having hair loss, I'm going to want to know, like, what's your thyroid doing? And again, look at serum levels. Spironolactone is a great one. Oftentimes it can take a very low dose of 50 milligrams to really kind of get on that and improve it. And oftentimes it's kind of a seasonal thing where you may have some hair shedding and then it stops.
And let's see. Okay, we have just 2 more questions. Dr. Klesaris, can you take those last 2 questions? If I have liver or kidney problems, could I still use the pellet?
So again, we want to look at this as a complete spectrum of everything. It depends what level that is. And we just look at the metabolism. So if like this is a severe liver disease, we're going to look at the metabolism, but otherwise it's not a contraindication in general.
Yeah, I mean, you have to look at the you know, what's
Gonna
what
check the blood
reason for all the liver or kidney problems, and you know, all the labs associated with that and your function. But in a vacuum, the pellet wouldn't be it wouldn't be contraindicated in that situation. Do you look at DHEA or cortisol?
We do. So that is part of our hormone panel, like Karen was saying. We don't just look at 1 or 2 hormones. We look at many, many multiple hormones, because like hormones, again, they work in a symphony, and it's difficult to look at one without the other because they affect each other. We have to look at DHA and cortisol, look at your adrenal function as well. But we want to look at progesterone to estrogen ratio. So is an estrogen dominant or progesterone dominant? So again, we're looking at a multitude of hormones. And then we're also looking at the factors that turn on or turn off your hormones, like your micronutrients.
Okay, so if anybody doesn't have any more questions, then I think that concludes our session, which is actually right on time. We're 4 minutes before the hour. And again, just shop Dr. Jennifer Walden for the promo code BioTE for 21% off all products until Feb 1st. And thank you so much for joining. We'll probably send you something so you can watch this again if you needed the information. Yeah, we do this. All right, thank you.
Thank you.
Everybody.
Okay, good night.